Welcome to Bloom Health. Today we are diving into the Sickle Cell Disease series. Sickle cell disease is a serious health problem that affects the shape and function of red blood cells. It affects millions of people around the world, particularly those of African, Mediterranean, Middle Eastern, and Indian ancestry. This disease causes red blood cells to become misshapen, taking on a rigid crescent or sickle shape. These sickle-shaped cells can block blood flow by clumping together and sticking to the walls of blood vessels. This blockage leads to severe pain, known as sickle cell crises, and can cause significant organ damage over time. Sickle cell disease is a global health challenge that requires coordinated efforts from healthcare providers and researchers worldwide. We need to learn more about it through ongoing research and education to develop effective treatments and management strategies. Understanding this disease can help us find better treatments, improve patient care, and ultimately enhance the quality of life for those affected. It can also improve the lives of people living with sickle cell by providing them with the necessary support and medical interventions. This image shows the stark difference between healthy red blood cells, which are round and flexible, and those affected by sickle cell disease, which are rigid and sickle-shaped. The distorted sickle-shaped cells can clump together, obstructing blood flow and leading to various health complications, including stroke, acute chest syndrome, and increased risk of infection. Red blood cells are vital. They are essential for our survival and play a crucial role in our overall health. They carry oxygen throughout our bodies, delivering it to every cell and tissue. This oxygen is necessary for cellular respiration, which produces the energy our bodies need to function. In sickle cell disease, these cells become deformed. This deformation can lead to various health complications. Instead of being round and flexible, they become stiff and crescent-shaped, like a sickle. This rigidity makes it difficult for them to move through blood vessels. This change in shape is caused by a mutation. It affects hemoglobin, the protein in red blood cells responsible for carrying oxygen. Hemoglobin is a protein in red blood cells. It carries oxygen from the lungs to the rest of the body and returns carbon dioxide from the body to the lungs to be exhaled. The mutated hemoglobin forms stiff fibers. These fibers cause the red blood cells to lose their normal shape. These fibers distort the shape of the red blood cell, making them less efficient at transporting oxygen and more likely to cause blockages in blood vessels. This illustration highlights the structural difference between normal hemoglobin and sickle hemoglobin. The mutation in sickle hemoglobin leads to the formation of stiff fibers. The mutation in sickle hemoglobin leads to the formation of stiff fibers, which distort the shape of red blood cells. This distortion can cause severe health issues, including pain, anemia, and organ damage. Sickle cell disease is inherited. This means it is passed down from parents to their children. It is caused by a mutation in the gene that makes hemoglobin. A child inherits one copy of the hemoglobin gene from each parent. If both parents carry the sickle cell trait, there is a chance their child will inherit the disease. This Punnett square illustrates the inheritance pattern of sickle cell disease. It shows the probability of children inheriting the disease depending on the genetic makeup of their parents. People with sickle cell disease often experience various symptoms. These symptoms can range from mild to severe. The most common symptom is pain. This pain occurs when sickle-shaped cells block blood flow. Other complications can arise from sickle cell disease. These include anemia, stroke, acute chest syndrome, and organ damage. These complications can severely impact a person's health and quality of life. This poignant image captures the reality of living with sickle cell disease, showcasing the pain and suffering that individuals, often young children, have to endure. Early detection, better outcomes, the importance of timely diagnosis. Early diagnosis of sickle cell disease is crucial. Newborn screening can identify babies with the disease at birth. Early diagnosis allows for prompt medical intervention. Early intervention can help manage symptoms. It can also prevent complications. Treatments like penicillin and hydroxyurea can significantly reduce the risk of infections and other health issues. This image emphasizes the importance of early detection through newborn screening programs, which can identify sickle cell disease and enable timely medical intervention. Managing sickle cell treatment options and ongoing care. While there is no cure for sickle cell disease, treatments are available. These treatments focus on managing symptoms and preventing complications. Pain management is a crucial aspect of care, often requiring strong medications. Blood transfusions can help address anemia. Hydroxyurea, a medication, can reduce the frequency of painful episodes. Regular medical checkups and ongoing care are vital for individuals with sickle cell disease. This image depicts the collaborative nature of sickle cell disease management, with healthcare professionals working closely with patients to develop personalized treatment plans. Raising awareness, improving lives. The power of education. Raising awareness about sickle cell disease is essential. Education can help dispel myths and misconceptions. It can also promote understanding and empathy for those living with the disease. Increased awareness can lead to better support systems. It can also encourage more research to find a cure. We all have a role to play in supporting those affected by this disease. This image showcases the power of community engagement in raising awareness about sickle cell disease and fostering support for affected individuals and their families. Looking forward, research and hope for the future. The future holds promise for people with sickle cell disease. Researchers are working tirelessly to develop new treatments and ultimately find a cure. Gene therapy, for example, offers a potential avenue for a cure. Clinical trials are underway to test new medications and therapies. The advancements in research offer hope for a brighter future for those living with sickle cell disease. This final image conveys a message of hope, highlighting the dedication of researchers working tirelessly to develop new treatments and ultimately find a cure for sickle cell disease. Stay tuned for more on Bloom Health.